Hi everyone, welcome to week 1 of the qualitative research course. This week we are going to introduce the discipline and practice of qualitative research. An overview of our discussion today, we will begin with looking at the role of qualitative research in evidence-based practice. We will talk about the definition of what qualitative research actually is. We'll cover the characteristics and philosophical underpinnings of qualitative methods and talk about a brief history of qualitative inquiry. Your assigned readings for this week are from the textbook Creswell and Poth, and it's the first 2 chapters. So, first topic is the role of qualitative in evidence-based practice. And first we have to say, what is evidence-based practice? EBP is the integration of best research evidence with clinical expertise and patient values. Let's break that down a little bit. Clinical expertise is developed through clinical training, continuing education, experiences with your patients or your clients, and sometimes it's appropriate to incorporate the clinical expertise of others. For instance, a colleague with more experience in a particular area than you or a different practice area. Patient values come from obviously the patient. That's how we deliver the best care possible and design programs most effectively when we consider patient values. This also includes the patient's family and understanding the patient's role within their family. This might consider cultural influences or the patient's goals for therapy. So let me come to the third part of that evidence-based practice triangle and think about how we define best research evidence. You may be familiar with levels of evidence or recommendations of research evidence. And when we look at this, we see at D or level 5, expert opinion without explicit critical appraisal or based on bench research but not on clinical research. A grade of 4 or C might be from a case series. With things that get a grade recommendation of B are cohort studies, systematic reviews of cohort studies, reviews of case control trials, or an individual case control trial. But when we give something a grade of A or level of 1A or 1B, we're talking about randomized control trials and systematic reviews of randomized control trials. So this is our typical intervention research where we compare 2 treatments to see which one has the better effect on the outcome that we're interested in. You might notice qualitative research isn't anywhere in that hierarchy. And this is a course on qualitative research, so where does it fit? The important thing to remember is that when we talk about the best kinds of research, the best kind of research method depends on our research question. So when we're asking questions about intervention efficacy, randomized control trials are absolutely the way to go. They are the best way to compare 2 treatments to one another or a treatment to a placebo. An example might be about constraint-induced movement therapy, and is it more effective than usual care in treating hemiparesis? When we're talking about questions about diagnosis or prognosis, a cohort or a case control study might be better. For instance, you might ask a question about after successful treatment for an initial episode of major depression, what's the average length of time before recurrence? You can't assess that in a controlled trial. You need to follow a cohort prospectively and evaluate that. When we have questions about client experiences or concerns, qualitative studies are really the way to go. We might want to know about parents of children with autism and sensory defensiveness and how they navigate family mealtimes, for example. The only way to really get at their experiences is to ask them about it and get that information directly. And there's certainly cases where ethical reasons would prevent us from doing a randomized control trial or even sometimes a cohort study, so qualitative methods can be used in those places. And if we think about a qualitative evidence pyramid or hierarchy, the RCT is going to be at the bottom. It's not going to be the top of our hierarchy. What we really want to see as we get higher up the qualitative chain is evidence from a number of qualitative studies, either descriptive studies or more theoretically based qualitative studies, so either multiple studies or a systematic review of qualitative research are the things that are going to give us the most reliable evidence for qualitative research questions. So to sum up, how might qualitative research contribute to evidence-based practice? It helps us at getting the patient values and perspectives. It can contribute clinical expertise on questions of lived experience of disability by drawing evidence from other clinicians. It might lay the groundwork for clinical effectiveness studies by contributing to the development of more relevant interventions. So by better understanding the circumstances and context, we can develop better programs and treatments. Sometimes it may be the best available evidence, even for an intervention or prognosis question, if it's a new area of study or there haven't been any large quantitative studies to draw from. And again, it may help in understanding or interpreting whether the findings of a clinical trial or some other kind of quantitative study are relevant to the situation at hand. So we're talking about how to use qualitative research, but what actually is it? If we look at the dictionary definition of what research is, it is a careful or diligent search, or a studious inquiry or examination, especially investigation or experimentation aimed at the discovery and interpretation of facts, revision of accepted theories or laws in light of new facts, or practical application of such new or revised theories and laws, or the collecting of information about a particular subject. And one of the reference books that I use a lot is they define it as a systematic process by which we know more about something than we did before engaging in the process. So what you'll see kind of in common across these definitions is that it is a process of inquiry and that we might call it a systematic process as well. Now, when we define qualitative research, this is from an earlier edition of the Creswell text, but it's very similar to the definition in your current edition. Qualitative research begins with assumptions and the use of interpretive or theoretical frameworks that inform the study of research problems addressing the meaning individuals or groups ascribe to a social or human problem. To study this problem, qualitative researchers use an emerging qualitative approach to inquiry, the collection of data in a natural setting sensitive to the people and places under study, and data analysis that is both inductive and deductive and establishes patterns or themes. The final written report or presentation includes the voices of participants, the reflexivity of the researcher, a complex description and interpretation of the problem, and its contribution to the literature or a call for change. And drawing from another resource, the word qualitative implies an emphasis on the qualities of entities and on processes and meanings that are not experimentally examined or measured. So we're interested as qualitative researchers in the socially constructed nature of reality, the relationship between the researcher and what they are studying, and the situational constraints that shape the study itself.